Welcome back to session 9 of reproductive health. In this session, we will talk about family planning. So effective and efficient family planning is one of the valid strategies for reproductive health, or one of the components of reproductive health, and one of the strategies of safe motherhood. So this session we'll be discussing family planning, and so by the end of the session I expect each of you to be able to describe the traditional and natural family planning methods, and then also explain the lactational amenorrhea method of family planning. And so we'll be looking at 4 main areas. We will try to define family planning, we will talk about the traditional methods, natural methods, and finally the lactational amenorrhea method. So you can contact, or you can download or get some more reading on family planning using the following URLs, which are available on the Sakai website. So what is family planning? Let's try to define family planning. According to the World Health Organization, family planning is the practice of controlling the number of children one has and deciding on the interval between births by means of contraception. That is family planning. The number of children you want to have, the spacing between them using contraception. So it is important that we talk about this because a family or a couple without family planning tend to live a chaotic life, as you can see in the picture on your screen. The woman is pregnant, there are 2 babies, there's another baby on the neck of the man, and there's another one the man is pulling, then they have a newborn and the woman is pregnant again. That is the life you have if you don't have family planning. So now let's look at traditional methods. Before the modern methods came, there were some traditional methods of family planning. So let's talk about those ones. What are they at all? These may be described as birth control methods that have lower efficacies than the modern methods. Lower efficacies means that they cannot be so well trusted, or they cannot be so well effective. And these are abstinence, withdrawal method of coitus interruptus, coitus femoris, and then polygamy. So having looked at these, let's quickly look at the modern contraception, or the natural family planning methods. Why do we refer to them as natural family planning methods? These are methods, for monitoring and interpreting the physiological signs of the body of the woman, or identifying the biological markers of fertility and then dealing with them appropriately. So these methods are used to determine the fertile period of the woman, and then the couple decides if they want a child, they decide to have sex during the fertile period, or if they don't, they avoid it. So natural family planning means abstaining from genital sexual intercourse during fertile times of the cycle of the woman, and this will avoid pregnancy. Not using contraceptive to interfere the fertility period can also be described as natural family planning. So what is the physiology behind this natural family planning? We are not here to talk about the menstrual cycle, but I just want you to remember that there are so many things that happen in the menstrual cycle. We have the menstrual phase, the follicular phase, the ovulation phase, and then the luteal phase. And there are hormones that are produced within each phase. They all come together to help the individual identify that fertile period for either conception or avoid it. So there are 3 main phases. We have the pre-ovulatory phase, where you can also have 3 stages, the menstrual phase and then the follicular phase. So pre-ovulatory means that the woman is here to ovulate. Ovulatory phase means the woman is ovulating. And then we have the period after the ovulation, which is also referred to as the luteal phase. What are the hormones involved here? So we have the follicle-stimulating hormone, which is the one that stimulates the eggs or the ova to ripe. Then we have the luteinizing hormone, and then estrogen and progesterone. So, the diagram you see or the picture you see on your screen is the full menstrual cycle of a woman. So the follicle-stimulating hormone usually will be the first to stimulate the ova to ripe, and they compete in that process. When they are ripe or they get to the peak of it, then another hormone is released that causes them to rupture, which is the luteal hormone. Ova are ripe, at least one of them rises to the level where it is supposed to rupture to release the egg or the ova or the ovum. So at that level, there is another hormone that is released, which is the luteinizing hormone. Luteinizing hormone is the one that causes the follicle to rupture, then it releases the egg, and we say the woman has ovulated. Now at that period, when the follicle-stimulating hormone is released, it also causes the increase of another hormone, which is estrogen. After the rupture, then the empty sac that is left produces progesterone, which is sometimes referred to as the peace hormone. So progesterone would come and make the lining of the uterus a little more secretive than before and more tortuous. So at that point, we can say that the uterus is ready to receive, the zygote, if there's any pregnancy. If there is no pregnancy after ovulation, then the lining of the uterus will shed again as menses. So basically or briefly, that is just the process through which women or ladies menstruate. Now, what are the signs of peak fertility? What are the signs of peak fertility? Throughout the menstrual cycle, we have talked about the period where the woman ovulates. There are certain signs that you can use to say the woman is ovulating. And these are the cervical. You can use the cervical mucus. At that time, it may be clear, stretchy, and slippery. Then at a certain time, it may come to a point where you can stretch it between 2 fingers. You will soon see a diagram on that. If the woman is ovulating, it also means that the body temperature, the normal body temperature, increases a little bit more, and she may feel a little warmer. It also means that the luteinizing hormone is at its peak. So there are 4 basic or 4 key methods of natural family planning. And these are the cervical, using the cervical mucus to determine when the woman is ovulating, the basal body temperature, the calendar methods, and then what we call the symptothermal method. Now let's talk about the cervical mucus. The cervical mucus can be used as a sign of fertility, or the way the cervical mucus changes can be used as a sign of fertility. So right at the beginning, from about the 10th day of menstruation, the first picture you see is an example of how the secretion should look like. So it becomes thicker as the cycle progresses. The day of the ovulation, it becomes clearer, which is the last picture on the slide. It becomes clearer. You can stretch it between two fingers without a break. And that is a good sign that the woman is ovulating. Now let's look at the basic using the body temperature to determine the fertility period of the woman. So I mentioned earlier that when the woman is getting close to ovulation, the body temperature increases. And so for you to be able to know when the body temperature would increase, it means the day the woman starts to menstruate, she has to start recording her own body temperature so that she will get to know the level at which it increases. And that is what tells the woman she is ovulating. Now, women have different cycles. The shortest is 28 and the longest is 35. For the calendar method, a woman who wants to use the calendar method must know the number of days in the cycle. If you have a 28-day cycle, the day you ovulate will be different from somebody who has a 35-day cycle. And usually, the cycle starts from the day you start to menstruate. That is day 1 of every cycle. And the cycle ends till you menstruate again. So the previous day of the next menstruation is the end of the previous cycle. Now let's talk about the symptothermal method of the natural family planning. So this method, for a woman to use this method, it means that you are able to use the signs of fertility in addition to recording your body temperature. And together, you are able to tell when you are ovulating. So the symptothermal method is about, if it is used correctly, it's about 99% effective. Now let's look at the benefits of natural family planning. First and foremost, there are no harmful effects. You are not on any medication, and so no side effects. It supports reproductive health, and then environmentally friendly because there are no chemicals involved. It is free and adaptable. You can adapt it to suit, to either avoid a pregnancy or achieve it. However, it requires a good communication, among or between the partners. It can also encourage sexual maturity. So let's talk about Lactational Amenorrhoea Method of family planning, which is part of the natural family planning. LAM is a family planning method based on the normal physiological processes that are happening in the woman's body. So what happens is that when a woman has a baby, it means that there's an increase in the prolactin level of the woman. Prolactin is the hormone that stimulates the production of milk. And once prolactin is high in the system of the woman is not likely to ovulate because high levels of prolactin suppress ovulation. And so in non-breastfeeding women, ovulation returns at about 45 days after birth. That is if you are not breastfeeding. But it may occur earlier, as early as 21 days. However, if you are breastfeeding very well, it is expected that you can use LAM as a family planning method because breastfeeding very well means that there's the production of prolactin, and that means that the woman is not ovulating. And this is what we are talking about. So if you put the baby to breast, as the baby is sucking, more prolactin is produced, and that means that There is no ovulation, so the woman is not ovulating. So the tendency of the woman becoming pregnant is very low. And this is how it is, or it can be used as a family planning method. You cannot use it if you are not breastfeeding or if you are not breastfeeding well. But if you do, then it's a good method. So this is the process that I just described. So now let's look at the process. It is not every woman, as I said earlier on, that can use LAM. What is the process by which, if you go to or you have just had a baby and you want to use LAM as a family planning method, what do you need to do? Or what would the nurses and doctors, what is the process that they will take you through? So they might ask you, have you had your menses? If you say yes, it means that you are probably beginning to ovulate. So if you have had your menses, it is not possible. They may also ask you, are you supplementing or giving your baby other foods? If it is no, that is good. It means the baby is also only breastfeeding on the breast milk. If it is yes, it means the time when the baby is eating other foods, you are likely to ovulate because the baby is not sucking. The prolactin level is not as high as it should be. Is your baby more than 6 months old? Babies that are less than 6 months old, they tend to suck more than babies that are more than 6 months old. And so if your baby is less than 6 months old, it means the baby is sucking more. The baby is not eating any other food apart from breast milk. And so we are sure that your prolactin level is high. Then it is recommended that you can use LAM as a natural family planning method. So for LAM to be effective, the woman has to do the following, or the following has to be present in the woman, just as we saw in the previous slide. The woman's menstrual bleeding has not returned, or you have not started bleeding. She exclusively breastfeeds her baby, and the baby is less than 6 months old. So if a woman has to decide to use LAM, she has to be able to satisfy all these 3 conditions. If LAM is used very well, it is about 98% effective, and therefore it can be compared to other modern contraceptives. So what are the advantages of LAM? LAM effectively prevents pregnancy if it is used well. Because the woman is not ovulating, the tendency of pregnancy occurring is very slim. It is provided and controlled by the woman. The more you put the baby to breast, the more your prolactin level and the less your chances of ovulating. It is universal, or is universally available to all women. You don't have to go and see somebody to give you permission to use it. Once you satisfy the 3 conditions, you are ready to go. It does not require supplies and procedures. It's economical. You don't have to go for any injection anywhere. No hormonal effects. So what do you think may be the limitations to LAM? What are the limitations to LAM? LAM offers only a temporary contraceptive method, only for 6 months. After 6 months, you cannot rely on LAM anymore, because after 6 months, baby may be eating other foods, and so the baby is not sucking as often as possible. It is not usually appropriate if mothers will be separated from the baby for a long period of time. So if you are a working mother and you have to leave the baby behind and go to work for 8 hours, you cannot use LAM. It's also not feasible for all breastfeeding mothers, especially HIV positive mothers. So in summary, this session discussed the traditional methods of family planning. We also talked about the natural, and then we talked about LAM. The next session will discuss modern contraceptive methods. So this